Candice Desalegn, live in Group 2 studying at KSMU, and in this video I'll be discussing how to observe, report, and the necessary actions that are needed in case of common post-operative complications. So why is post-operative care necessary? Well, first things first, this is where our patient is taken to a recovery room to recover from anesthesia that was given to the numbness that was given to the patient before the operation. So when our patient is stabilized, what we need to do is identify who our patient is, assist the patient from a stretcher to the bed, stretcher to the bed, check for any necessary instructions that the head nurse or the nurse in charge has provided for the patient, and also notify the nurse if I will notify the nurse as a nurse assistant for any rise of complications, any change in the patient's vitals. So when observing and reporting, what you need to focus on is the level of responsiveness of the patient. We're checking whether our patient is alert, is drowsy, is unresponsive. We're also checking for restlessness. We're also checking for blood pressure, the change in blood pressure, the pulse rate. Looking at the pulse rate, we want to know whether it is weak, rapid, or irregular. Then we're checking for the changes in temperature, respiratory rate, dyspnea, which is the difficulty in breathing, nausea or vomiting, complaints of pain. These are common complaints that the patient might experience after surgery. We're going to check for hemorrhage, which is bleeding, coughing, or choking. Right. So looking at our patient is our patient is a patient who just received brain surgery, removing a brain tumor. So this is 1 hour after post-operation. So our patient's name is Sarah Toppins. Sarah, how are you? You fine. How are you feeling? You have a You feel thirsty too. Okay, so the patient has just notified me that she's feeling thirsty and she's feeling pains. But before I do that, I'm going to check her vitals. I'm going to put this down. I'm going to check her vitals. First, I'll check her temperature. Okay, can you gently open your eyes? Okay, I'll hold. I'll check her temperature, wait for a few minutes, and take it out. Looking at her temperature is 36.5, which is normal. Then I'll check her pulse rate. Gently check her pulse rate. Okay, I can feel her pulse. She has a regular pulse, a very regular, that is normal. Then I'll check her respiratory rate, counting how many times her chest rises per minute. Looking at it, she has 16 chest rises per minute, which is normal. And then I will look at her vitals. Her IV solution is looking normal. The flow is normal, is a regular flow. And now she told me that she's experiencing pain. So for pain, I'm going to ask for the location of the pain, the intensity of the pain, and the type of pain she is feeling. So a remedy for this is to change her position. So seeing that she's in supine position, I'm going to change the position of her head. Maybe like there's pressure or tension on her neck, so I'm just going to gently change the position of her head, gently, without hurting her. Okay. And then I will apply a warm compress on the. Oh, I have to. Just add a warm compress, right? And then I put a new dressing, right? Okay. So she also complains that she's feeling thirsty. So when a patient is feeling thirsty after post-operation, what you would want to do is give them some ice to chew on, some water to drink, but then they'll just rinse their mouth with it and dispose. Okay. Water. and you come and you'll be checking your patient regularly. Also ensuring that every after 2 hours we're going to be changing the position of our patient to prevent bed sores and any types of pain that might arise.